indeed, this speech was done at a peculiar and difficult time that this country is going through, which is the COVID-19 pandemic, which of course occasioned the speech to be done in November, while naturally it's supposed to be done earlier in the year. The numbers that were allowed in the chamber were fewer. We were very few members who were allowed into the chamber. And indeed, it is a peculiar time. It is not normal times. By the time the president was speaking, we had 66,000 infections, 66,723 infections, and 1,203 deaths. There are many deaths. We're actually experiencing the second wave of this pandemic, which is quite lethal. We're losing so many people. The number of deaths just this month is more than the deaths that have been occasioned in many months combined. And I think it is for us to be more careful. There's what the government can do, but there's what we must take as personal responsibility. When I speak earlier on, we had been optimistic. I was chairing this COVID committee. And part of what we were told was that the virus was attenuating, and the strain that was affecting us earlier in the year was a milder strain than what had been happening, what was in Europe and parts of the Americas. Madam Speaker, that doesn't look like the case now. And in fact, it would be good, I wish the Committee on COVID, if it still exists, or the Committee of Health now, that the COVID committee's term ended, would call KEMRI again. Because KEMRI had made a lot of groundbreaking initiatives, culturing the virus, doing analysis, and we have the best analysts and medical researchers on the continent of Africa. They need to come and give us an update on what they are seeing and why the spike in deaths. I don't think the spike has been occasioned, Madam Speaker, by the night curfew. That one has little to do. We assume that the virus wakes up at 11 or at 9 p.m. During the day, we can be flouting the rules throughout the day, and then think that if we go at 9 p.m., that then at that point is when the virus shows up. But during the day, if you go around the country, if you look at the kind of meetings that people are holding, politicians are holding, we are really being irresponsible, Madam Speaker, during the day. And Kenyans must know this virus doesn't wake up at night. It is there with us during the day and everywhere. When you asked if somebody is less than 2 meters near you, to have your mask, to sanitize, we need to take those things seriously. Madam Speaker, if you look at how the speech was arranged, I want to just start on the economy. We have done, I think, 9 reports as the COVID committee, previously, and they've gone on. But the pillar on the economy, I think, leaves much to be done. We're grateful, Madam Speaker, that by the time the President was speaking, the tax measures that had been introduced, the reduction of corporate tax by 5%, income tax, which is pay as you earn, VAT from 16 to 14%, would make the government forgo 176 billion shillings a year. But, Madam Speaker, we also note that there's been savings. For instance, the education budget, which runs to almost 200 billion, not being expended apart from salaries. And so what we expected, especially for small and medium-sized enterprises, was this credit guarantee scheme. Credit guarantee scheme of at least 200 B, so that those companies or those medium-sized enterprises, the restaurants, the hospitality industry that had to lay off people would be equipped to keep those people working and be able to pay them. By the time we brought those proposals, Madam Speaker, months ago, many countries have done serious stimulus programs running into trillions, and we could be able to do that. We've just had the CS Treasury speaking about it, Equity CEO speaking about it, but real businesses are still hurting. So we acknowledge the President's goodwill and his intention, but at this point, it should not just still be a plan. There needs to be implementation of those proposals, especially on credit guarantee scheme. 5 billion is a bit low. The issue of the health workers, and we are staring at almost a crisis soon, where they're going to strike. We're glad our measures, we've done better than many countries. I don't know what that light means, how many minutes. Madam Speaker, sorry, Madam Speaker, if you could advise me how much longer.
You have 3 more.
I've not spoken for 7 minutes, Madam Speaker.
5 more minutes.
Oh, thank you. I've not spoken for 7. Madam Speaker, with these 5,000 health workers were to be hired much earlier. We hope that can be done. And as in the words of the President, we're not yet out of the woods. Madam Speaker, one of my highlights, because I'm seeing the time, is what the President said in paragraph 48, that East Africa's premier mental health facility will now offer training and research in psychiatry, specialized psychiatric services, forensic psychiatric services, child and adolescent mental services, and substance abuse-related and addictive disorders. Madam Speaker, a renewed focus on mental health wellness is needed in this country. It is a crisis. On Friday, I'm glad I was able to visit with Dr. Frank Njenga and his clinic, and just saw the number of young people who are there, and those are those who can afford. But across the country, in our counties, from level 1 to level 4, very many people are suffering from mental health challenges. We don't have clinical psychologists. I'm glad I was able to meet County Public Service Board chairs after that, as chairman of Labour Committee, and told them, you don't even have clinical psychologists as part of your schemes of service. Let us renew our focus and our money and even budgeting in county level to mental health. It is a crisis. It is a challenge, Madam Speaker. And when it comes close to your doorstep, that's when you will get to realize we need to renew those efforts. I'm glad we have one of the pioneers and the biggest champions for mental health, Senator Kasanga, in this house. Senator Kasanga, don't get tired. Don't just think about your bill, but think about the awareness you can raise, even with county assemblies, the money we give them for health. Let us even think of ring-fencing some for mental health, Madam Speaker. Madam Speaker, the President says that in economic development, it is not about the intention, but about results. It is not about the volume of what we do, but the impact of what we achieve. I'm glad he spoke about dealing with the poverty of dignity in terms of housing, and I'm glad with what is happening in Nairobi so far. With the NMS, we can do more. We need to do more in terms of housing. We've seen what is in Park Road and many of these areas, bachelors, etc. More can be done, but I acknowledge the President's focus on Nairobi as a county. It has really helped us over the past few months. And I'm glad, because we raised the question when BBI report was released, that the services or the functions of Nairobi were being transferred permanently. Madam Speaker, I am 100% against that. You cannot transfer permanently functions of one county. And I'm glad that so far the steering committee has listened to us. And Nairobians deserve devolution like anybody else in this country. That lady in Mutwini needs to have somebody she can hold politically accountable for her health services. You know, people want to touch and feel their leader. If you read the book of Samuel, the Israelites were told that if you have a king, this king will be so bad to you, they will take your chief. But they said, no, we want a king over us. So let's not solve a temporary problem with a permanent solution. We've had 2 governors who failed, but that doesn't mean that we will not get it right. We will get it right as Nairobi. And on that one, I am glad that with the document that is coming out on Thursday, Nairobians will still have proper devolution in this city. The President spoke about a holistic base of human capital that is food secure. Extremely important. The frontier of this country's economy is we focus on value addition. Agriculture, which is 33% of our GDP, is only producing 3% of revenue. And that tells you there's much to be desired. Once we look at the entire value chain of agriculture, if we are serious, Madam Speaker, we will not have issues of unemployment. We will not have issues of giving young people piecemeal donations to give them a livelihood. But throughout the value chain of agriculture, that is 33% of our GDP, but 3% of revenue, we will find these jobs for young people. So it's not just about food security, but about manufacturing and making sure that the value chain entirely creates that holistic base of human capital, jump-starting the shift from net consumption to net production. Madam Speaker, I am glad that the 35%, even as I move to wind up, because I'm seeing time is not on my side, 35% to many people, Madam Speaker, who are saying that we're already giving counties more than 35%.